You don't know anybody who's in favor of waste, fraud, and abuse in government, right? I mean, that's why every administration says it's a problem, and every spending package you've ever heard about says when you factor in waste, fraud, and abuse, we'll actually save money, right? And look, the Trump administration is not wrong. You launch an all-out war on fraud, it's going to be well received. And he appointed his head of Medicare and Medicaid, Dr. Mehmet Oz, to lead the charge in his space, fighting what the administration says is costing Americans over $100 billion annually. So, when he's not watching Bobby Kennedy wrangle snakes from his patio or doing pull-ups, chin-ups in his case, and Ramaswamy, who seems to have a fear of going all the way down, how does the good doctor plan to go after fraud? Dr. Oz joins us now. You look good, Doc. You look good. Ramaswamy, not so much.
Well, he looked pretty good, too. And Bobby, he was supposed to chase the snakes off of the patio. He decided to catch them instead. But nevertheless, that is a reflection of the courage he has in general. And those snakes were mating, by the way, which makes them especially difficult. They're black razors. I would have run, which is what I tried to do. He made me film him. And I think if you listen to his beautiful wife Cheryl's admonitions to get rid of the snakes, Bobby, please put the snakes down, you probably would have agreed with her. But let me answer your question.
Listen,
Chris. You ask how we're dealing
ahead.
with this. I feel like I'm Johnny Cash. I'm going everywhere. I was this week in Ohio and Iowa. I was in Los Angeles, Minneapolis. I mean, we're traveling around the country trying to find out how these different fraud schemes work. And the reality is they rhyme with each other. They're not identical. There are differences. In Ohio on Tuesday, I was in front of a house that the owner was able to run a massive home health care fraud scheme. She was billing for people who were deceased. That's not a good look in court. She's going to jail. You may have caught this story. The largest user of Botox in the country, at least the largest biller of Botox, is going to jail because she wasn't giving Botox to people. It was a big fraud. We have in California, as you know, about 1/3 of all the hospices in the entire country. This is a wonderful program, well designed to take care of people at the end of their life. In New York, where you are, we have the #1 job in the entire state now being personal care services. So the bigger issue for me is not just that we're wasting money. And that $100 billion, by the way, just to put that into context that the average viewer can understand, if you're working your tail off and you're hoping that Medicare is there for you when you retire, you will double the life expectancy of the Medicare Trust Fund if we can take the fraud just out of Medicare. So there are real stakes to being able to do this correctly. But the bigger issue, Chris, is if you're willing to steal someone's money when they're down and out, when they're vulnerable, you'll also steal their health. You'll steal their life. And we're seeing this over and over again in some of these tragic
I'm with
cases.
you. I'm with you. Nobody's against it. I just wish that you'd go to the head of the snake and take on the healthcare companies and their vertical integrations where they seize all of the different layers of profit making. And then, of course, that price structure gets passed over into what you have to deal with Medicaid and Medicare. I mean, that's the head of the snake. Waste, fraud, and abuse is a real thing. But that is an aberration. The design of our system allows these people to get paid off other people's pain.
Well, we had a massive payment today from an insurance company. We have had huge changes in how the insurance industry and the big hospital systems are working with us. The pharmaceutical industry, as you know, has given back about $600 billion through the most favored nation drug pricing that the president insisted on. Again, to be straight up with everybody, you might not know this, 1 in 3 Americans will leave a drugstore without the medications that the doctor prescribed to them because they can't afford it. Ironically,
That's right.
Part of the reason for that is we're paying 3 times more on average per person for the exact same drugs as you could get over in Europe or in Asia, Canada, which is why it just was patently unfair. Global freeloading had taken money out of the American people's pockets. And that went on for decades. It's gotten worse in the last 10 years, but it's been going on for decades. The president stopped that. That's $600 billion back in the pockets of Americans. And TrumpRx.gov, which I don't know if you saw this, but we're now up to 700 drugs. More than half of all the drug prescription transactions in the country. Yeah. Oh, yeah, working with Cuban, because Mark's got an excellent company. Others have joined as well. They're putting all their generic products on the site. We've got all the most favored nation drug price branded products on the site. These are big wins.
Listen, they're wins. They're wins. I don't think they're big enough wins. Why? Because the best idea, no disrespect to you, Doc, was the president's. I'm going to call in all the healthcare big shots, and they'll come when I call them. And they're going to come in, and I'm going to say to their face, you're making too much money. We're going to change it with you or without you. It's the best thing he said as president of the United States, and it just went away. I respect your efforts in explaining them here to the American people. You are always welcome to do so.
God bless you. He has done it. He's delivering. He's got Congress sort of moving along slowly, but you can't do it just by making proclamations from the Oval Office. You do have to have the help of other arms of government, and that's why the president has been pushing for the great health care plan. And we have the kinds of wins I mentioned with most favored nation drug pricing, with some of the work we've been doing with the vice president's task force. Again, it puts pressure on the fraudsters. They know we're coming after them. They're not walking away. They're running.
Right.
And that's exactly the attitude you want to have if you're the federal government. And the rest of it is making progress. We're dealing with prior authorization, which, as you know, is this heinous process where an insurance company reaches its long arm into your doctor's office and stops you from getting a procedure you need. We now have all the insurance companies agreeing, and they come to the table, double-digit reduction of those. The changes we've experienced in healthcare, in addition to just dealing with the legalized money laundering that happens in the system, are massive. Not going to change in a year. It's going to have to take a little bit of negotiating. But one of the things we have done that I think everyone should pay attention to is we don't just talk about it. We went out there and actually reached across into the private sector and say, guys, come work with us. We have ideas that are good. You have ones as well. Your ideas are probably more nimble. Plus, we're here for 4 years. We want you to change the system in a way that's sustainable for long after we're gone. And they are coming to meet us in the middle.
Well, listen, good. I look forward to the results, because what we both know is everyone's paying more for life insurance, for health insurance, and they're getting less. So I look forward to seeing what comes of it, because the need is great. Dr. Oz, I got to jump. Take care of yourself. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.